You're listening to our social newscast with me, Sam Marshall, and today we're talking to Dr. Jean Bassett, who's a director at the Witkoppen Clinic in the north of Johannesburg. She recently wrote an op-ed thanking all essential workers in the front line, but she also highlights the pressure placed on the overburdened healthcare system due to the COVID-19 pandemic. I can't express the gratitude that we should be feeling towards our frontline doctors, our nurses, the people that have really put their lives on the line, not only in South Africa, but around the world, Doctor.
Yes, Sam. Sam, thanks very much for having me today. Yes, I'm only one of the people. There are just so many hundreds of thousands of doctors and nurses and frontline healthcare workers who on a daily basis put their lives on the line to ensure that the nation in South Africa, all the people of South Africa and in fact around the world can be cared for in a compassionate and appropriate way.
You wrote an op-ed. I mean, I'm not a healthcare professional. I am fortunate enough to have stayed in lockdown. But what you put in your op-ed paints this really vivid picture of the struggle that individuals like yourself and your colleagues go through on a day-to-day basis. I'm going to offer this, that as the public, we don't get a sense of how difficult it is in the front line.
Yes, and in fact, the very first day that it came home to me was really on the first day of lockdown when I left home and there were so few cars on the road. And I felt like there'd been an apocalypse the night before on the way to work. And it gives one this sort of eerie feeling that, are you in this alone? And in fact, when you arrive at work, even though it's an incredibly stressful environment, this environment has created a huge sense of camaraderie amongst the healthcare workers. Everybody is prepared to help each other and to almost go beyond the call of duty to ensure that each of their colleagues is, able to do what they need to do on a daily basis. The support amongst the healthcare workers is really quite profound, even though it's under immense stress. I think the staff on a daily basis feel that there is a lot of anxiety and separation from their families. They are very concerned that if they do develop symptoms, what's going to happen to their families? Are they going to be separated from their family? The idea of being in isolation with the rest of the family in the rest of the house or alternatively at a different place is very difficult. A lot of my colleagues have, in fact, their husbands, wives, and the children are living in a different place to them, so they don't get the support at the end of the day that they usually receive. And that is difficult to work with.
You've also, in your op-ed, talked about the critically low supply of equipment. And we see all those donations, various institutions donating to medical supplies. Is that reaching you guys in the front line, or at the rate you're going, it's getting depleted incredibly fast?
Unfortunately, at the rate that we're going, it is being depleted incredibly fast. And unfortunately, also, there are people out there who are profiteering. So the cost of the PPE often goes up twice a day. And what was affordable yesterday is no longer affordable today. I'm really pleased to hear that the government is doing something about that, because for people to profiteer at the expense of people at the front line is something which I think is really not fair. And I'm really pleased that the government is doing something about that now.
I must admit, I'm a little bit guilty. I got so wrapped up in the COVID-19 situation, the pandemic, that you forget a place like Witkoppen Clinic doesn't only deal with COVID testing, but deals with day-to-day ailments as well. How have you been able to balance and manage the fact that you are operating in the surrounding areas, but then you still have the day-to-day traffic?
So it's really important that people who have got chronic diseases still continue to take their medication. People who are HIV positive, it's vitally important that they continue to ensure that their antiretrovirals are taken daily, and our diabetics and hypertensives. If they don't, their immune system becomes compromised. So we ensure that people do get their medication. We, in fact, actually make a plan. If somebody wants a special arrangement to be able to collect their medication, we will accommodate special requests to ensure that people who have got chronic diseases can obtain their medication. What we also do is we screen every patient for COVID who comes to the clinic. And the patients who screen positive, we separate them from the people who are negative. They go to a separate part of the clinic to ensure that those who are coming for, a tummy ache or a sore toe or whatever, they're not in contact with the patients who have screened COVID positive.
Doctor, just want to take one step back. You talked about supplies running critically low. You're happy that government is stepping in against the profiteers. But are you getting the amount of supplies that you need? What is your stock levels at now?
So we monitor stock on a daily basis. So some stock I have 3 days worth, and obviously then, there are quite a few people, especially in pharmacy, who are trying to ensure that we do get more stock. Other stock, we do have stock availability for a little bit longer. So we monitor on a daily basis to ensure that we will have sufficient stock for the next few days. It's not the way I like to operate, but we've never had a day when we don't have enough PPE for all our staff. And that's really thanks to many of the people who have donated funds to Witkoppen for that.
You did feel compelled to write about it in your op-ed. Why write the op-ed? The reason I'm asking this question is because we as the public, we are a little bit confused because there's two stories. Government is saying there is enough stock. There are a lot of people that have come forward to donate, to buy. And then we hear from people like yourself saying we are running low, that we don't have enough, that we need more.
So ordinarily, we would not operate with such a minimal stock on hand. To know that you don't know whether you're going to have sufficient stock for Monday is really not the ideal way to operate. It creates a lot of anxiety for the staff, not being sure as to whether we will get sufficient stock in by Monday. And also, it's not a very good utilization of resources that one is continually chasing stock when, in fact, if there was sufficient stock available, you would order for the next 2 weeks and you would have that stock on hand, and then you would order again 2 weeks later. So it's a very ineffective way to operate, and the staff are always told, be very careful with the stock. You need to conserve the stock because we don't know what we've got for Monday. And that is where the concern comes. And it creates a lot of stress for a healthcare worker if they don't know whether they're going to have an N95 mask on Monday to utilize when they're seeing, the TB patients or the COVID patients.
Doctor, as a professional that's been in this space for more than or close to 30 years, in your mind, in your history, have you ever operated under these kind of circumstances? Have you ever had to deal with morale being so low, staff being stretched so thin?
No, we haven't. We've, worked through the HIV epidemic. We still continue to work in that particular space. And we've never had to deal with any virus that is as contagious as this. And it means that the healthcare worker has to be very alert all the time. They can't afford to make any mistake at all, because a mistake can mean that they will then infect themselves or could affect others. And it's not a nice place to be working.
You talked about it in this interview, but also in your article, you're talking about the great personal sacrifice that all of these healthcare workers, including yourself, has had to endure over this period. but data shows that we're not even close to the peak yet. I don't know if it's a terrible question, but how do you see this play out, Doctor, especially as you're dealing with your colleagues on the ground? You've said in some instances they've moved out of the homes that they've lived in. They've moved their families out of those homes to just make sure that everybody is safe. How do you see this play out?
I don't think anybody really knows how it's going to play out at this particular point in time. Coronavirus is new to all of us, and we're really not sure how it's going to play out in South Africa in particular, because we have such a high burden of HIV, and also this country the healthcare is very unequally proportioned within South Africa. There are so many people who have got limited access to healthcare, and therefore we're not quite sure what's going to happen. If COVID does go into the informal settlements where people aren't easily able to practice social distancing, if there is no water available, it's incredibly difficult to wash your hands, and we are worried about what's going to happen then.
But I also mean from a resource perspective, Doctor. How do you see this play out for your staff? Have you been able to recruit more? How have you managed as a leader within your structure to kind of balance the expectation of staff, managing their morale, and at the same time knowing that this wave that everybody's talking about is coming?
So we have taken on additional locum staff. Currently, we have 5 additional locum staff that we have taken on. And I mean, that comes at an additional unbudgeted cost, which is very difficult to manage. But, we do draw on professionals who have had past experience in terms, or maybe are retired right now, and ask that they can rejoin the workforce and sort of add value and also support the COVID epidemic. It's also really important that we don't make the staff work too many additional hours, because they need to ensure that they get rest so that their immune systems are not compromised. Just a very minor thing that, well, it seems quite minor, but with the number of hours one is allowed to exercise per day between 6 o'clock and 9 o'clock, when one has to report on duty between 7 and 7:30, it's incredibly difficult to be able to get any exercise in. And exercise, we all know, is a really important part of maintaining one's health. So I do think that is an area where there could be some consideration and leniency in terms of those restrictions.
Doctor, as CEO of the Witkoppen Clinic, you're obviously in conversation with leaders, with other doctors at your level, at executive level. What is the kind of conversation that you're having with each other at the moment, whether it's in the province of Gauteng or across many provinces?
I think the key at the moment is, how can one do things better and smarter and innovate even under these very difficult circumstances, and to share work experiences in terms of how each different clinic is actually operating, to see whether something that we are doing is something that in fact could work at another organization. And likewise, it's very important to keep communicating and understand how different organizations and clinics are actually responding to the epidemic.
Doctor, final question from me. I don't know if we've been talking for 16 minutes. So I'm not going to hold you for too much longer. I just want to understand very, very quickly. I know you guys are in the communities. What is the current situation like in the communities, bearing in mind that you operate within Fourways, Diepsloot, Mashawawa, in the neighboring townships? What is the current situation like? What is the feedback that you're getting from your staff on the ground?
So in the informal settlements, it's very different from the areas around Fourways, for example. In the informal settlements, people are very, very anxious and are very worried. The level of understanding in terms of how COVID-19 is transmitted from one person to the next seems to be poorly understood. I think the messaging out there, it just hasn't managed to penetrate the informal settlements. So unfortunately, they don't understand the importance of social distancing. It is a behavioral change which is always not easy to implement. There's a lot of anxiety around food, which one sees in other media on a day-to-day basis, and that is a very real situation in the informal settlements. And a lot needs to be done about that.
Doctor, thank you very much for your time. I know time is a valuable resource for you at the moment, and just the ability to speak to us, I do really appreciate. And I just want to thank you and all your colleagues for just kind of putting your lives on the line every day and putting South Africans first.
Thanks, Sam. Thank you very much for hearing our story. Really appreciate it. Thank you.
For more stories like these, go to www.social-tv.co.za, subscribe to us on YouTube, and follow us on our social mediums.